Hey, how's it going everybody? Remy Sovereign here from RemySovereign.com. With today's new video, what I wanted to talk about is swimming. And is swimming effective in the treatment of lower back pain? Now, swimming is often quickly prescribed from a lot of healthcare providers, whether that be doctors, maybe PTs, chiros, or just even other individuals recommending swimming as a form of treatment of lower back pain or something that people should try out. And the way I look at swimming is that just like any other activity is that it may be helpful for some and it may not be helpful for others. And I kind of previously did a video about this with regarding yoga, and I kind of gave the same kind of spiel with regards to that. And it kind of comes down to what is the yoga program look like? And so essentially, what does the swimming program look like? And so if we break down swimming, swimming is just kind of a general activity itself. What specific strokes are an individual doing? Are they doing a breaststroke? Are they doing a butterfly? Are they doing maybe a front stroke or back crawl, or whatever the case may be? The point is that some of these strokes, or essentially all these strokes, are going to place different stresses on different parts of the body depending on what is performed. And some of those strokes may actually, or some of those kind of swimming movements may cause flare-ups in individuals, and that would not be good, and that's not something we want. And so when doctors kind of quickly prescribe swimming as a form of treatment for lower back pain, whether that be maybe for a herniated disc case or maybe a different kind of sort of back pain case, it may not be, it's not a good idea to kind of do that, or for maybe a doctor to do that. And the reason being is because they're just kind of recommending swimming from a general point of view, and they're not actually telling individuals how to swim. They're not teaching individuals how to swim. They're just saying, okay, go do swimming. Okay, what's my swimming program should it look like? You know, am I doing a front crawl, back crawl, breaststroke, butterfly? And the reason being, as I just previously mentioned, is all those different kind of movements or activities or those types of strokes are going to place different stresses on the body, and some of those strokes may actually cause flare-ups in individuals. And I can specifically relate to this because swimming was an activity that was originally recommended to me, and it's something that I tried in the early stages for my herniated disc recovery. And I actually noticed that the kind of front crawl and the butterfly and breaststroke were three kind of movements that caused flare-ups within my lower back and actually caused pain and kind of made things worse. So I initially kind of just cut swimming out after trying it a few times. So the point that I was trying to make there, guys, is that we have these healthcare providers quickly recommending an activity without even knowing how to maybe perform it or how to teach it. They don't know how to teach swimming, so why are you even recommending it? Because you may be making individuals' cases worse if you're kind of giving them, essentially you may be steering people in the wrong direction. You're not giving them a specific program. You're just saying doing swimming, but it doesn't give an individual enough information about what they should do for swimming. And that's where the problems may kind of develop. And so if you even look at elite swimmers, a lot of elite swimmers out there, they essentially get lower back pain problems. And they may get specific issues with regards to maybe their facet joints. They may get kind of a pars fracture, and that would be a result of maybe doing the butterfly or the breaststroke consistently over time for a long period and constantly going into that hyperextension position, and then combined with maybe other activities doing in the weight room with a combination of axial loading, that could cause those kind of maybe pars fractures or facet joint issues to kind of arise over time, or those stress fractures. And so that's all the point that I'm trying to make, guys, is that swimming may be helpful for some people. Swimming may not be helpful for some people. And essentially, only one would really know until they kind of start trying different activities out in the pool, or if they have maybe an elite level coach that can actually teach them how to swim properly in terms of using it as a treatment or a type of kind of exercise in the treatment of their lower back injury. But this kind of comes back to, guys, what is the individual's lower back injury and why are we prescribing swimming? So why we prescribe swimming? Because it's a low impact activity and it's a way that individuals can improve their fitness without putting a lot of stress onto the joints, specifically with regards to maybe the lower back, if we talk about the lower back. But swimming, just like any other activity, guys, program needs to be individualized. Not everyone's gonna have the same swimming program if they do swimming, and not everyone should be doing swimming for maybe their lower back injury or whatever other injury they may have. So that's the point that I'm just trying to make here, guys. And it's a question that I've constantly kind of asked is, should I do swimming? Is swimming helpful for me for my lower back injury or for my lower back pain? And it all comes down to, it depends, guys. It depends on what the program is. But a lot of doctors out there, A lot of healthcare providers or individuals are just quickly to kind of prescribe swimming without actually giving an individual or to teach an individual how to kind of properly program swimming or even teach an individual how to swim. Here's the thing. We are prescribing someone swimming, yet some people don't even know how to swim. It doesn't make any sense. That's where that's where I have a big issue with, guys. We're prescribing swimming, but we're not actually teaching people how to swim. Some people may come into the doctor's office, have never swam before, or don't know how to swim, and yet here's a doctor recommending, okay, go to swimming. Okay, well, I don't even know how to swim. And then, they may refer you out, obviously, but unless the doctor does know how to teach swimming, I don't know, but you never see a doctor that teaches swimming. They're there for other reasons. But that's just kind of the point that I'm trying to make, you guys. Be careful with kind of what your program looks like. Everyone needs an individualized program. If you're going to do swimming, make sure you're doing it in a safe and you're doing it in a kind of a comfortable manner where you're working at your own pace and you're not kind of triggering any pain. If you're triggering any pain, there's your first indication that maybe this movement, activity, or stroke you should not be performing, or it should not be advised for you, and you may need to change the swimming program, or maybe you just need to cut out swimming for this time being until the pain comes down. So that's kind of just what I wanted to talk about, guys, with regards to swimming and its kind of effectiveness in lower back pain, because it's commonly prescribed as a form of treatment for individuals. And it may be helpful for some people, it may not be helpful for others. My case wasn't helpful, but for others, individuals may find it helpful for maybe their lower back injury or lower back pain case, whatever it may be. But just kind of wanted to talk about that because I know it's a question that I get commonly asked. And if you're someone, guys, that has maybe found swimming helpful, I'd love to hear your story. If you're someone that maybe has actually found swimming to be worse for your case, and if you're performing certain strokes like the breaststroke or the butterfly or something like that, and that kind of specifically triggered things, made things worse, I would love to hear about that story, because typically the butterfly and breaststroke are kind of two kind of strokes that have been kind of more linked to causing problems in elite swimmers with specific regards to their lower back issues over time, as they consistently kind of do that over time combined with other activities as well. And just wanted to kind of make that video, guys. So if you have a story with regards to that, I would love to hear about your experience with regards to swimming and your lower back injury or whatnot. Love to hear about that. And we'll just wrap it up for this video today, guys. Hope you guys enjoyed this. I wish you guys all the best and a successful and productive day, and take care.